And I'm Monica Jacko, Head of Equality and Diversity for Workforce at Cambridge University Hospitals. And today in this session, we are focusing on how we can become an anti-racist organisation. And in 2022, last year, our Trust Management and Staff Side Forum, our Director of Workforce, signed up to the UNISON Anti-Racism Charter pledges to help us achieve our aim to become an anti-racist organisation. And our Workforce Race Equality Standard Action Plan has been refreshed to align with that. And I've been working with Ben Matanga, UNISON Staff Side Secretary, who is joining us today, so that we can share that anti-racism policy at Reach Network meetings and other forums. And we thought this would be an opportunity to socialise it and get people understanding and increase awareness of this anti-racism charter and what we as a trust have signed up to. And I'm really pleased to welcome and introduce our guest speaker today, Tim Roberts, who is Regional Secretary of UNISON Eastern Region, to speak to you today about the UNISON Anti-Racism Charter and how we can become an anti-racist organisation. And he will speak for a few minutes, and then after his talk, there'll be an opportunity for colleagues to ask questions, and please put them in the chat or in the Q&A. We are recording this session so colleagues can access this conversation at a later point after today. So without further ado, can I hand over to you, Tim, to share your reflections about how we can be an anti-racist organisation. Thank you.
Thanks, Monica. So yeah, thank you for allowing me to take part in this web discussion today. So my name's Tim Roberts. I'm the regional secretary. So I'm the kind of I've got the honour to be the senior manager of UNISON within the 6 counties of the Eastern region, working with about 50 of my colleagues to support the work of about 750 volunteer activists, people like Ben, who's on the call today, who work every day to improve the workplaces in the Eastern region, where we have 82,000 members across the public services. You know, when I talk about kind of anti-racism, and when I think about anti-racism, kind of I often focus on the journey that we've had, where we're going, and where we've come from. And as a country, I would like us to I'd like to start the day by taking us back a little bit in time, back to 1965. It's a long time ago, the year when Winston Churchill died, the first spacecraft orbited Mars, year when Malcolm X was assassinated, and the world population was less than half of what it is now. So the world has changed immeasurably, and it was the year then, the first year, when the UK's first bit of equality legislation was passed, so the Race Relations Act. And for the first time, discrimination on the grounds of colour and race, ethnicity and nationality was outlawed. And so if it was a simple case of legislation, things would be okay, wouldn't they? About 60 years later, 60 years of legislation outlawing race discrimination, we are sadly still in a country where racism exists. And of course, the manifestation of that racism has changed. You know, we know, you know, one of our senior black activists in the union from our region, he currently works for the Ambulance Trust, East England Ambulance Trust, but he started work in a hospital not too far from where you are, and he started work in the 80s. And then when he returned to his locker in an area where only staff could access, when he returned to his locker at the end of his shift as a hospital auxiliary, there would be a swastika put on his locker. There would be racist graffiti on his locker. So that is what happened in public services in the NHS in the 1980s. And that was not an uncommon experience. And thankfully, for black workers in the NHS, they very, very rarely report that kind of racism now. But that does not mean that they do not experience different types of racism. And I think I probably need to be clear. In UNISON, we use black. It's the year of the black worker for UNISON. You know, we don't mean black meaning African or African Caribbean, as we would often do in kind of outside of the union. We choose to use black in its kind of political sense, to be people who are at risk of not only at risk but do experience racism and exclusion and discrimination as a result of the color of their skin. So we know that black workers in the NHS do have different lived experiences at work than their white colleagues. And the focus of our anti-racist agenda did receive some more than a degree of intensity over the last few years. And one of the kind of boosts for that was the racist murder of George Floyd back in 2020. And that kind of generated the Black Lives Matter movement, not just in America, but in this country. And that was a very symbolic, very tragic, but very symbolic example of a black person dying with the knee of a white person on the back of his neck. So we talk about Black Lives Matter, and we often talk about Black Lives Matter about in the context of the criminal injustice system. And that's not what I can talk to you about that, but that's not why I'm talking why I am here today. But I am really clear as a trade unionist, as a black worker, that when we talk about Black Lives mattering in this country, it's not just about the experiences of the criminal injustice system, it's about the experiences at work and in our economy. So when we have a society where right now that the levels of unemployment within black communities are 3 times larger than they are in white communities, when we know that a black male graduate earns 17% less than a white male graduate, you know, we can't just excuse that by education or experience, because they're talking about graduates. When we talk about whenever data is collected, that when it comes to recruitment, redundancies, dismissals, around pay, that actually there are differential outcomes. That's true within the public services, and that's true within the private sector. And there is a mixture of occupational segregation, that black workers find themselves in the worst paid jobs on average. We know about low wages, we know about insecure employment, we know about the impact of the hostile environment around immigration policies. You know, with but UNISON is the largest trade union within social care. We know about the impact of the health and social care visa has around the exploitation that black care workers are experiencing. But people come over on a visa and then are exploited by their employer. You know, the contributory factors to the economic exclusion of many black workers are many. So we need to work together, and that's what about being an anti-racist organization is. It's about commitment, fundamentally, to work together, to do something, to do lots of things actually, to create change, because change isn't going to come by itself. And so since 2016, as many of you will know, the NHS trusts have had to publish workforce data on race equality. And every year I read the summary of the data for NHS trusts across the east of England, and it's not a particularly happy read, to be honest. There is not your hospital trust, but another hospital trust in the region where there so let's be clear, this is the hospital's own data. It's not Unison's data. This is the hospital's own data, that a white shortlisted applicant is 3.5 times more likely to be offered a job than a black applicant. There's a mental health trust in our region where their data proves that black staff are 3 times more likely to be disciplined than white staff. This is not history. This is what's happening now in the NHS in the east of England. And we've talked in the NHS about a duty of candor, and I think we need to be candid about the experiences within your trust. So we know from the data which your trust produce that ethnicity, the ethnic makeup of middle management is broadly what it is within the workforce. That is a positive thing. But actually, when you look at senior management, when you look at the board level, there is a significant underrepresentation of whites, of underrepresentation of black senior managers and black board members. We know that when it comes to shortlisting last year, that 1 in 3 white applicants were shortlisted. 1 in 3 shortlisted applicants who were white were offered a job, but that statistic is 1 in 5 for black shortlisted applicants. We still know that black staff are 50% more likely to be disciplined than white staff in your trust. These are not insignificant discrepancies. And your trust has had that data since 2016. Your trust has known that black staff have different experiences of different detrimental experiences to their white peers for 7-8 years now. Yeah, so let's just be honest together. We have to move away from a position of defensiveness. We need to move away from talking about the things that we have done collectively to actually what has been the impact of those. So I do not doubt that things have been done, but the impact clearly is not where it should be. So there is still much more work to do. And actually, while I am going to acknowledge that within the NHS, it is a good thing that you and any other NHS employer produces the data, because it does shine the light on the problems. And it doesn't mean that the NHS is worse than the police service or local government or anywhere else. It means that the light is shone on your problems that in more than many other sectors. What that cannot be, those discrepancies which I've talked about, that cannot be attributed to the actions of a few bad apples. Yeah, and as a union, we will always support, and we've always supported individual black members who, who report acts of discrimination, and we support them through, whether it's a grievance within or bullying complaint through their own employer, or taking that through an employment tribunal, and we address individual issues. But we're talking about collective workforce issues which need to be addressed. About a workforce culture, which means that black staff do not feel, and I'm going to say this generally across the NHS, do not feel that they are as supported as their white peers. That black staff will report that they know how you get on in their organisation, and the organisation is if your face fits. And if your face fits, you get a bit more support, you get a bit more encouragement, you get access to training, which not all people do. And that is the culture within the NHS, is that if your face fits, you get on. And unfortunately, what it means is that many black staff know that their face doesn't fit. They might not be subject to explicit discrimination, but they know that they do not benefit from the informal support, mentoring, and encouragement which their white peers experience. I 25 years ago, I was working in student services within a university in the Southwest. I was a UNISON member. I was a UNISON activist, and it was the election of a Labour government and a desire to address issues of inequality. The Labour government, they commissioned the Macpherson report into the murder of Stephen Lawrence, and that report, that inquiry, went much broader than looking at the failures of the racist police force at the time. They looked at what happened within the institution of the Metropolitan Police to ensure to result in some of those mistakes, because some of those mistakes were a result of individual racist police officers, and some of it was around a culture within the Met. And it came up with a phrase which again no black worker was surprised to hear, that within public services in the UK there was an issue of institutionalized racism, and legislation was passed, which created a positive duty on public authorities to take steps to address issues of race inequality, positive steps to collate data. Every public sector body had to collate data. Every public sector body had to do impact assessments. We had to come up with an action plan. And there was a bit of a change actually in the early 2000s. And then there was, I'm not going to get political, but there was a change of government with a different focus, let's put it that way. There was Brexit, there was the pandemic, and actually a number of public bodies took their eye off the ball. There was austerity, which meant that equalities teams were gutted. That there was, I remember, I was at Bristol City Council, where I spent some time working at the beginning of the 2000s. You'd have an equalities team within each department, as well as a corporate equalities team within a large local authority. And now within local authorities, you might have one equality a person working on equality and diversity full time. So the legislative requirements were removed. The staffing were removed because public bodies had to make financial decisions. And the equality and diversity work in this country has been deprioritized over a number of years. And so it is not a surprise then when we see that periods of issues around racial inequality still exist. So now is an opportunity, I think, for those of us that want change, that believe in change, that know that we deserve something better in our workplaces. Now is an opportunity for us to come together and do something, and that's what the anti-racist charter, which the trust signed up to last September. That's what the charter creates. It's an opportunity for the management and trade unions to come together to think about what the issues are, to commit to change, and then to deliver that change. That charter came out of a discussion which some of our black activists had within the region around how to kind of push the debate forward. And so that's why the charter was created, so that there was a tool, there was something concrete for employers to work towards. And I'm very pleased that we've got nearly 30 public sector bodies in the region that have signed up to it. Charter covers a number of areas. What senior leaders do to champion the importance of diverse workforce and to challenge racism. What does leadership mean around anti-racism? The importance of having something tangible, a document, a strategy which addresses the issues which each employer face. The importance of monitoring the impact of that strategy. Again, from a candid perspective, if things haven't worked, we don't need to hide, we don't need to use smoke and mirrors, that we can talk about why things haven't worked and then come up with a different approach. That actually having race equality auditing processes, looking across the board at recruitment practices. So is it, for example, that as a trust you are not getting enough black applicants for all jobs, for management jobs? Is it you're getting the applicants but they're not being shortlisted? Or is it that you're getting you are shortlisting enough black applicants but they're not getting the job being offered to them? Or is it a combination of all three? But it's actually having a bit of a forensic and a bit of an honest look at your recruitment processes to see where the problems are. And if you're not clear about where the problems are, then you're not going to be able to come up with the appropriate solutions. Looking at why are black staff more likely to be disciplined? What is it within the culture of that? Sometimes there is about, we've done some work in some NHS trusts. Sometimes it is about white managers going too quick into a disciplinary process. And sometimes it's the opposite, actually. Sometimes it's white managers being afraid of managing black staff. So performance is not tackled at an informal point, at an early point, and then allowing that behavior to continue. And then suddenly, because that behavior hasn't been nipped in the bud, suddenly it becomes an issue. And that's when the first intervention happens. Yeah, I don't know what the issue is within your trust because I haven't got the data, but that's something which I think is worth looking at. Because if you're looking at the solutions, you might have to come up with different tailored solutions around that, looking at considering what issues that become apparent. The charter covers things like equality training. Not just equality training for all staff, but what does equality? What specific training do managers need? What specific training do senior managers need around leadership? The charter covers issues around the ethnicity pay gap. Yeah, in the same way that UNISON believes that, in the same way that the gender pay gap should be statutory, that UNISON believes that the ethnicity pay gap should also be statutory, and we're campaigning for that, reporting on that. Until that happens, we are working with individual employers to voluntarily do that, and I'm really pleased that your trust has signed up to report on their data in much the same way that you're already reporting on your gender pay gap. Because once you're clear about that gap, once you're clear about whether that gap is static, getting worse, getting better, then you can think about what the strategies which you can put in place to respond to it. So, it is good. It is good that you have signed the charter. It is good that you have committed and you report on your ethnicity pay gap. But the reporting of issues is the start. It's a very good start, but it is just the start. So the issue for all of us is, what are we going to do about it once those discrepancies have been exposed? So I think, obviously as a trade unionist, I know that we've got got a very active UNISON branch within the trust, a number of very active, very skilled and black activists. And I think that this is, whether it's this is an opportunity actually for our black members within the trust to get involved in a process which delivers change for them and improved workplaces. Fairer workplaces don't just benefit black staff, they benefit all staff. So workplaces where people can be their authentic selves, workplaces where people can say, actually, when you did this, when you said this, when you asked about my hair, where that actually I didn't like it because of X, and that is heard and that is understood. Yeah, it's not, again, we move away from a position of defensiveness where people can feel confident to point out when that they're not happy, and their colleagues can listen and then can change their behavior. That's not just an issue for Black staff. That's not just an issue around race. That's about having a healthy workplace culture. So, you know, I think very clearly when organizations commit to become anti-racist and start taking action around anti-racist, it benefits all staff, black and white. One of my favorite poets at the moment is a woman called Andrea Gorman, who you may have heard. She performed at Biden's inauguration ceremony 3 years ago. And one of the line in her one of her poems, which I think about maybe not every day, but certainly several times a week. And it's that we learn that the norms and notions of what just is not always justice. The norms and notions of what just is not always justice. And I think that when we talk about our equality work, we talk about how organizations are, how organizations have always been, the processes, the systems, the culture, and that we have to be honest that actually they do not impact on all people equally. Because if they did, we wouldn't be here today talking about it. We wouldn't be thinking about why there are still problems 60 years after the first piece of equality legislation. So this is where do we go from here? We are, and as you said that you are, you know, that as your trust wants to be an anti-racist organization, it needs to be clear that as well as challenging explicit racist behavior, it needs to take forward its duty of candor, which it would apply in clinical settings, in malpractice settings, to the context of equality and diversity. That actually that we will move away from a position of defensiveness, that yes, we will talk about things that have been done, but only in the context of the outcomes of those things and the journey which is still still ahead of us. That we will do stuff. Today is a great opportunity to talk, but actually it is the doing that makes a difference in workplaces. That anti-racist employers identify and utilize tools and plans and strategies which are unique to their workplaces or unique to teams and areas within their workplaces, because there might be different strategies applying to different directorates. If it was easy, it would have been done. So I'm not here to say that it is an easy task ahead of you. But I think what we're all clear about is expressions of sympathy and fine words are not enough. So a year after the signing of the charter, I think now is a perfect opportunity for us to redouble our efforts, to accept that the progress has not been good enough, and commit to delivering further and more meaningful change. You know, Martin Luther King talked about the fierce urgency of now. That resonated 60 years ago, and I think it resonates now. Thank you.
Thank you very much, Tim. Thank you. It's, yeah, the time for action is now. We've done enough talking, and I just really wanted to highlight the important role of the cultural ambassadors, who have really been key to supporting our Black and minority ethnic staff, so that we've reduced the number of Black and minority ethnic staff taken through a formal disciplinary process. So now in the last 2 years, there's been no difference. But actually what we found out that in the system, and if you highlighted, Tim, that other people management processes in terms of performance management, there's they're being used disproportionately against Black minority ethnic staff. So this auditing pledge of how we really scrutinise all of our employee relations cases, our disciplinary and grievance cases, is a really key pledge that part of the Anti-Racism Charter. So we can't be relying on the role of cultural ambassadors to educate and work with our employee relations team. There's an education piece as well. And I think it's down to, yes, it's educating our leaders, but holding colleagues to account and that leadership accountability. And we know with the NHS EDI improvement plan, there's the top high impact action that all NHS organisations expect boards and senior leaders to have equality, diversity, inclusion objectives, and I would suggest that we have anti-racism objective within that. So it's around accountability, and education isn't enough. And yes, the systemic issues around recruitment still haven't. We're in the foothills of debiasing. We're doing a debiasing process, and again, I'd like to have a big shout out to the diversity inclusion panelists who have been very good at debiasing the recruitment processes so that we're making some improvement there. But there's more work to be done. And another priority, as well as career progression and educating our leaders and colleagues and accountability, is having a zero tolerance culture against all forms of harassment, racism, other forms of harassment and discrimination. And I'm delighted our comms team are now working around what is the public message we send to our patients and our visitors. But I like these pledges in the Charter. It's a lever for action so that we regularly review what we've signed up to. Those are my reflections on what you've shared, Tim, and I'd like to ask colleagues, and the Reach Network is the other staff network, has a key role to play to support our colleagues. Thank you. Over to colleagues for their questions. Ben.
Thank you, Tim, for that pretty comprehensive, and I think everyone's got that information now. There's no excuse. People can't say they don't know. Information is out there. I think coming specifically as someone who actually works in this trust, I think my major disappointment, I'm frequently the only brown face in meetings, and people believe the change that they can see. It's high time. I've been saying this for a long time. It's high time we had some change. It's not that difficult to get people to recruit people that look like the trust. We've got now fully 30% of Black staff, as in the political sense that we use it within the union. So that's all people of ethnic minority persuasion, BAME as the NHS likes to use, or BME. So that 30% is not being represented properly in this trust. And when it comes to messaging, I had this back and forth with the comms team and some others. I have a problem with the way this was done, because there's a group of people who are not fully representative of the population of this trust who are making those choices. Where are the choices? Where are the voices of the people that are actually affected by these actions? This is a sore point for me. I've said it repeatedly. I've said it to Monica. I've said it to David. I've said it to Roland. I have a problem with that. We need to include the people that are actually affected. I don't want this whole thing to be reduced to an academic exercise, which is frequently what happens. We tick boxes. We say we've got a plan and we've done this, and we produce a paper. We need to move from that. Action is what people are asking for. A lot of this, putting up posters should not take this long. It's taken a long time. I don't understand why. These are simple things that give reassurance actually to the people that are affected. And when that message is there, it's clear. People can't say they don't know. It's there in black and white. People can see it. And we then need to start taking action. We do have a policy anyway of excluding patients or relatives if they are being racist or any other discriminatory behavior. We've got the card system. We give a yellow card or red card, then we refuse to give services. These are things, these are tools that we already have. And I have a problem with this reticence with using zero tolerance. Why is the message ambiguous? Well, why are we leaving room for interpretation? It's either racism is wrong or it's not. A lot of this stuff is actually unlawful. So it's not a matter of just policy, local policy. So this is the message people need to actually understand, because I don't think it's happening at the moment, which is my gripe. I need people to actually get it, that the people that are affected by these behaviors, this has been going on throughout their lifetime. It's not just happened here. They've had to live with this stuff. This is why people then don't report anything. They don't have confidence in the system. There's actually anecdotally a rise in complaints with people in these incidents that are happening now. The more stuff that we got coming from overseas, the more incidents we're getting, and they will not be raised officially. A lot of people are afraid when they first come to the trust. They just don't have the agency to do that. So we need to make sure everyone in the trust is psychologically safe to speak and actually be heard, and that someone will actually hear them and act on these things. So we need to change the way we do things. And the first point is to make sure these panels that decide these things are actually inclusive. That is the first thing. If they're not inclusive, we're wasting time. They need to be inclusive. So that does need to change, and that needs to change immediately. We can't keep waiting for things to happen at a later date. If we don't get that right, then we're not going to get anything right, because you're excluding the people that are affected. So we can have all these shiny new policies, but without that buy-in from the people affected, that's not going to work. So that's my contribution.
Thank you, Ben. It's bringing diversity in senior leadership discussions and meetings, and some trusts will have a shadow board and they're working and they have that in place. So you bring diversity where it isn't into key decision-making forums. And yes, the colleagues, some colleagues get really vexed about the term zero tolerance. And actually the people who are vexed by it are the people not impacted by racism. Ben and I have had this discussion, and what we mean, and I think there's an education around what we mean by zero tolerance. We have a poster or a comms and constantly saying we will not, something will happen, you will be spoken to, a patient will be spoken to, or actually please respect us, we're here to help you. A poster that supports them in that, and saying that actually we can ask you to leave, we can withdraw treatment. People aren't fully aware of the policies that are there to support them. But if there's a comms campaign that backed them up, I think this organisation is very ambitious around clinical care and excellence, having virtual wards, using genomics for cancer treatment. It's fantastic, but we seem to be very anxious about using the term zero tolerance. And people say, well, that means that it's something that we'll never be able to do. But I said, well, actually, it's a health and safety issue. We are here to actually ensure that we protect our staff from harassment and abuse. It's our legal duty under the Equality Act. It's a health and safety issue. And you pointed out, Ben, the cumulative impact. Those so-called microaggressions aren't very micro. Where are you from? No, where are you really from? The cumulative talks, the slights, the exclusion, it causes biological weathering. It impacts people's physical well-being. Hence, it was risk factors for COVID. So I think there's a really important education piece around zero tolerance, what we mean, that we do something, there'll be a scale of responses, but actually we also don't expect the victim to make the report on CUSIS, or we have, all of us, it's everyone's responsibility to wrap our arms around our colleagues, check in with them, and even if it's happened on an inpatient ward or neurocritical care ward, for instance, or a patient with dementia that doesn't have capacity, I think we colleagues shy away from actually saying to the patient, actually, sorry, please respect us, respect my colleague. And we need to do a lot more education around what we can and can't say and how our approach is with that. And I did a really good session with the OT department last week, because there have been several reports of racial microaggressions, racial harassment on CUSIS that patients had treated their colleagues to, and how we work through those and the response and give people the confidence to tackle that and support their colleagues who are the victims of that. Rad. Oh, sorry, Gilly and then Rad. Yeah.
Thank you. And thanks, Tim. That was super useful. In my space, I'm the staff engagement lead for the trust, so I'm very close to some of the data that you are talking about, and I think there's sometimes a habit of thinking that if we're reporting on it, that is actually doing something. You know, it feels a little bit like that, and sometimes, and that's really uncomfortable. And some of the things that you're mentioning, I'm also responsible for managers development, leader development, and so really nice to see really clearly those expectations. But a lot of this is about raising that expectation, and a lot of what I hear in the spaces that I work are people that are too afraid to talk about their own experience, or who are experiencing things on the wards and don't necessarily have that backing from peers, or it takes a long time and they have to get somebody in charge to come and talk to somebody. And then also some really terrible examples where managers just aren't responding in a way that we need them to. You mentioned something around a duty of candour, and again that links to a lot of the evidence base that I have at the moment around our inability to have good conversations and really feel confident in those conversations. So there's no sort of you know, next year we'll be launching a new manager programme at CUH. So for anybody new joining, that these expectations will be really clear, and I'm really passionate about making sure we've got that included, and I've really been working hard on that already. But the age-old question is, okay, that's everybody coming in, but what about, you know, targeted support for people who are already here, and how can I really support staff and leaders to build those psychologically safe environments? This is nothing more than a bit of a rant at the moment, but just hitting on so many of the areas that I'm currently involved in around voice, around using our voice. And as the staff survey lead, I'll be out over the next few weeks going, oh, please use your voice, have your say in the staff survey. I know that people will fill that out and just give me the answers that they think the organisation wants to hear, because then they don't feel safe to speak up about how it really is. And that's not good enough either. So yeah, lots of food for thought. So just thank you for listening to my rant, and thank you for being so informative.
Thank you, Gilly. Rad.
Thanks, Monica. Yeah, I just wanted to sort of pick up on what you said actually about your colleagues. I don't know if you mean your colleagues, your board, but certainly the culture within the organisation being averse to embracing zero tolerance, and surely the challenge back has to be, if you're not prepared to embrace zero tolerance, then you're accepting tolerance of racism and other forms of discrimination, and that's simply not a position that an organisation or high up individuals within an organisation should be seen to be taking. So that I feel should be the challenge back to them, is by saying no, we're shying away from zero tolerance. Well, then you're embracing tolerance. And no, that's the wrong message. That's completely the wrong message to send out to people.
Thank you, Rad. As I say, there's an education piece constantly around that, what we mean by it. Thank you. Are there any more questions? Can we see anything in the chat?
Nothing in the chat or the Q&A.
Well, if there are no more questions and comments and reflections, I'd like to thank Tim for helping us have a conversation and using the anti-racism charter that we've signed to kickstart our events for Black History Month. And I just lots of food for thought, and for us to sort of, as you said, the time for talk is finished. It's time for action, and this is a really good lever, and we will be circulating and socialising our anti-racism policy in a number of forums with the Reach Network, who are absolutely pivotal in the work that we do to support anti-racism, as well as senior colleagues within the workforce team and other and board members. And I'll be the RES action plan will be going to the board next Wednesday, and we'll mention the UNISON Anti-Racism Charter and what we require leaders and the board to do. I would just like to highlight the calendar of events that have been put together with the EDI and the Reach Network team. And coming up for Black History Month, we've got the Reach Black History Month individual career conversations for nurses and midwives, which is happening next Tuesday, the 10th of October. Colleagues are booked onto that. Then the 11th of October, there's the Reach Network Black History Month celebration, growth and celebration event. All staff are welcome. There's a free lunch. There's a mixture of cultural food. It's going to be in the Hexagon, in the Frankley, face-to-face meeting. There's information and links to book in the staff bulletin, and that'll be 11:30 to 3. And that's celebrating the Reach Network anniversary, first year anniversary. 19th of October, we've got a Reach Black History Month webinar, which is virtual one. My History is Your History, with performance artist and historian Carol Leeming. 26th of October, we've got a Reach Black History Month webinar looking at the health experiences of LGBTQ+ people of colour with Black Beetle Health. So those key events coming up this October, and look on Connect. And thank you all for watching this conversation, and see you again soon. Thank you very much. Thank you. Bye.
Thank you. Take care, everyone.